5.
Welcome to our weekly Facebook Live from the St. Clair County Health Department. I'm Dr. Annette Mercatante, the Medical Health Officer, and we have a special guest with us today.
Hi there, I'm Dr. John Brooks. I'm an infectious diseases specialist, and I'm the Chief Medical Officer at McLaren Port Huron.
So we hope today to answer your questions as usual. I'll start out with a little bit of our data from the week, but please take advantage of the expertise that we have today in the room with Dr. Brooks and answer your questions, hopefully related more to the medical side of things, and we'll try and get to as many of these questions as we can. So our data today, as we usually present it, is here. We have a total of 486 cases. Almost 372 have recovered. And of most importance, only 3% of all of our hospital beds are COVID related, and 33% of our hospital beds are still available. So we have really good capacity, and our numbers of COVID are very stable. Let's go to the next slide for a second. We do have our maps that we present locally, so you can see where the cases, and again, the cases are primarily in the more heavily dense areas, but when we look at the rates of cases per population, there is no real hot spot in the community where you're more likely to get infected from COVID versus another, other than where you're more likely to be exposed to another human being. Let's go to the next slide. And I want to show this is a somewhat new way of presenting new case data. This is a little bit more meaningful for us and hopefully for you. Because we're a small county, numbers of cases, you know, as you have noticed, can be kind of erratic, up and down. And so what this does, it takes new daily cases, but it takes the average of them over a week. And so it gives us a little better idea with the variability, whether we're going up or down or stable. And what you can see is that for the last 5 weeks, there has either been a steady amount of cases or a decrease, which is really great, until the week of May 6th, where we have seen an increase. The top line are all cases that include our long-term care facilities and our jails, where we have had increased cases recently. But the bottom line are the cases with those numbers extracted. And what you can see is even with those cases extracted, there is still a small increase in just the past week. That's just 1 week, and we're going to continue to monitor that closely. Next slide. And then this is our dashboard, which I encourage all of you to visit on a daily basis. This is updated daily. However, in the coming weeks, we are going to update it Monday through Friday, just because our staff needs a break and things don't change drastically that much in 2 days. But please refer to that dashboard where you can get a lot of extra information. So that's an update of our data today, and we're going to next go to some questions. Do we have any new questions?
Yep, I have a new question from a Facebook viewer that says, please talk on the public testing for St. Clair County and any costs associated.
So the question about testing and whether or not it costs a person money, and that's a difficult question because it's not so simple. However, generally speaking, tests are not charged to your insurance. So if you have health insurance, there's no question you will not be billed a copay or a bill for your test. Now, many of these tests where we have accessibility in our community, you need a doctor's order. So to get a doctor's order, you do need to see a doctor, and there is a cost associated with that. More and more we have access to the Bureau of Lab Testing, and there is no cost associated with that, but we don't have broad drive-through accessibility for that. So for some tests, if you have no dollars, you're going to look at our website where test accessing is available, and places like Rite Aid where they have drive-through where you don't need a physician's order might be a reasonable place for you to go. More to come though. We're going to continue to work on that so the access is easier and easier for people to get even without insurance.
Is there a list where I can go to look for testing sites?
Our testing site list is listed on our website, correct? It's updated every time we find a new place to go. So do go to our website, scchealth.co, and you should be able to find that very easily.
How many tests, as of today, percentage of positives?
So our test As of today, we've completed 4,086 tests total. That's an average now of 175 tests per day. So that's significantly better than we were doing a month ago. Of those tests, 10.6% are positive. That is also coming down. And we consider a 10% positivity rate to be a fairly good indicator that our rate of transmission in the community is steady and low. Let's get one for Dr. Brooks.
Let's see. How does antibody testing work? Should I get an antibody testing to see if I have had COVID?
All right, that's really a great question. So the antibody testing is very difficult right now. Some physician offices will have an antibody test that's available, but it is not a high quality test. So antibodies are a thing that our body makes in response to an infection. And routinely, when we talk in medicine, we can talk about something that's common, is like hepatitis B. When I do a hepatitis B surface antibody test on a person, it means exactly what I think it means. It means that they've had the infection and they're immune. The difficulty with antibody testing right now for COVID is that we do not know what the antibody testing actually means across the board. There's now only been one test by a company called Roche that has been verified as a reasonable test for testing for antibodies for COVID. So what ends up happening is that if you get a test, let's say a finger prick test at your doctor's office, and it goes on a little piece of filter paper, there's a 60% chance that it's wrong positive and a 50% chance that it's wrong negative. So it's really bad testing. So we're certainly saying not to do those kind of tests because they're just very, very inaccurate. It doesn't tell you what you really want to know. Because what I'm sure, what the viewers want to know and what I want to know, if I do an antibody test, am I immune to COVID? Am I to the point in time where I'm not going to get COVID again? Because that is what we want to know when we do an antibody test. The answer is right now, there is no antibody test available by any platform that anybody's offering that we can look and say, does that tell me that? The answer is no. It will tell you, have you been exposed to the virus and did you develop antibodies? The answer is yes, which means you likely have had an infection. Now, the stuff you can get in your doctor's office right now by a finger prick, the difficulty is I can't tell you if that says you've had the infection. The numbers are so bad on those that I won't rely on that. So one where they do a blood draw and it goes to a laboratory that's verified the testing, that can then tell you with a high sensitivity and a high specificity that you've been exposed to the virus.
On the same lines of immunity, a question on Facebook is, what do you recommend for like vitamins, supplements, physical activity for boosting the immune system?
So the good news now is the weather has changed. People can get outside. Being outside is fine. You can easily stay 6 feet away from other people. You can socially distance. If you're out and you're in public and you are far away from people and you're doing exercise, you don't necessarily have a mask on to do that. It's when you're around other people you should have a mask. But still do respiratory hygiene. You know, if you're coughing, you should still cough into your elbow or cough into a Kleenex so that you're not contaminating things around you. As far as supplements, in my world, I believe in most people can take a general multivitamin. If you're older, take a Centrum Silver or something that has that. There are no supplements that have been shown to be helpful. However, making sure you have adequate vitamin C and adequate zinc in your system usually helps us in the face of any viral infection.
May I just make one comment, and that is this virus is very easily spread and infectious. So even a good immune system does not mean that you aren't susceptible to getting infected. You may be more susceptible to getting a greater amount of illness, more severe illness, but having a good immune system does not take you off the plate as not being having to be concerned about it.
Yeah, and that's a given. So, and the difficulty is that we see people getting really sick from COVID that are younger. It's actually their overactive immune system. Their immune system is reacting too hard to the virus, and that's what's causing the internal damage to their lungs and their organs. So it's actually an enhanced immune response that's causing the damage in younger people.
Not immune suppression.
Right.
Right.
This could be a question for either one of you. At what point is a previously COVID-19 positive individual not contagious?
Oh, that's yours, Dr.
Yes.
Brooks.
So the answer is that's difficult, but we can give you some data. What we're doing right now, let's say I get COVID today. So what's going to happen is in 14 days, if I'm well and if I had no symptoms for 3 days, we're going to look and say you're probably no longer shedding virus, and there's some data to that. So what they've done is that for people that are recovering, they're able to do what are called viral cultures. So we need to go to testing for a second. So when we do our testing now, when they put the thing in your nose and do the swab, we're doing what's called a PCR test. We're looking for the genetic material of the virus. We're not growing the virus. But if you want to know if the virus is infectious to others, you need to do a viral culture and actually grow the virus to see if it is still transmissible to other people. So what we're seeing is that PCR test that we do, that they put the swab in the nose for, that can remain positive for a while, because you can shed dead virus or partial virus for a while after your infection is done. But some studies that have been done both here in the United States and in China are showing by day 10, you've gotten rid of about 89 to 90% of the virus that you're shedding, and by day 14, none of the individuals that were recovered were shedding virus.
Another question, Dr. Brooks, what therapies are local doctors using to help patients? This mentions, you previously mentioned antibody plasma wasn't being used here, so what is?
All right, so convalescent plasma is available. Now there's been a difficulty of obtaining that because people have to donate the plasma. So you have to know you've had the infection, you have to wait a period of time, usually it's 28 days after the infection, and then get to a center where they can take the plasma and get it into circulation. So here in Port Huron, I can tell you at McLaren Port Huron, we've infused a couple of people with it with some excellent results. So it is available. As far as other drug therapy, the drug therapy people hear about is remdesivir. That's the antiviral therapy that actually started for treating of Ebola, that has now been switched over for the treatment of COVID. That is available at McLaren Port Huron. I do not know the availability at Lake Huron Medical Center or Ascension River District because the government has really stringently given that to only certain health systems if they had enough cases. And in the McLaren system, since we had 2 hotspot hospitals, we got a supply. So we do have the availability within McLaren Port Huron. If somebody comes in and they're in the ICU and they're very sick, we can get them remdesivir.
Next question is, you stated you don't do contact tracing beyond 48 hours of a known contact. Why only 48 hours?
Okay, so that's a little convoluted. Contact tracing of so we identify a case, and somebody is a confirmed or probable case, and they are symptomatic, they're sick. We will then do 48 hours prior to the day they got sick, as well as where they've been since then and who's been in contact. Now things get a little, and that's based just on the science of when you can start shedding the virus, that we know that you can shed the virus even before you show symptoms. Is it 72 hours? It may be a little bit, but those are the parameters the CDC has provided us. Now we're doing testing on people who aren't sick. Those are called asymptomatic individuals. And lo and behold, some of those people are positive. So what do you do with them? And what we've decided, based on the evidence that we have and the information, is to extend that contact tracing even more than 48 hours before the date that was tested. Since they're not sick, we can't use the date of illness. So we use the date they were tested, and we proceed that by 10 days. And look at where they've been for the previous 10 days to try and, again, just capture the most amount of people that they may have been exposed to.
Another question for you, Dr. Mercatante, is there any way to enforce a mask policy at a store? The other customers do not wear masks. Do restaurant employees have to wear a mask while working? Many don't.
And that's very difficult. As you know, the governor's executive orders require a mask in public when you are going to be within 6 feet of someone. And we know that it's the right thing to do. It helps prevent further extension of your respiratory secretion, so somebody else near you may not get infected. But we also know that some people can't wear a mask. Some people have conditions that makes it difficult for them to wear a mask. And some people don't have masks. Of course, there's some people who don't want to wear masks. So how do you enforce that? You have to use resources to enforce something like that. Hopefully, the public interest will make that common. But can we use our police force and our law enforcement to enforce that? I don't think we'll do that as a society in the United States. We really don't have that kind of militaristic type of approach to our community. So we're hoping that the people will just want to do the right thing and put the mask on. Now, a business can also refuse somebody to come in without a mask. That is the ability of a private business to say who can and how they want people to come in and receive services. So that's how we're going to approach it, but hopefully by improving on voluntary compliance and having businesses enforce those things within their establishment.
And if I may piggyback at McLaren, what we do is that we don't say, if you don't put a mask on, we're not going to take care of you, because people can come in very, very short of breath. But we can give them a Kleenex to cover their mouth, ask them to do the appropriate social distancing, and if they do cough, to cough into their sleeve, to cough with a cover cough, so that's going on. Now, I will tell you, we have great compliance. When people come to the hospital, they want to wear a mask, they want to feel protected.
You might have a different environment at a hospital
Correct.
than we do at the Walmart store. But
Exactly.
not that Walmart is worse than anywhere else, but.
Dr. Brooks, this question is for you. How often are you seeing thrombosis in COVID positive patients?
All right, so as you can tell by the numbers, we are not like New York or some other cities that they've had large numbers. So we have not had significant numbers of that. But what I can tell you is that when we noticed that in the literature that was coming out, so COVID's kind of different because this has kind of been a real-time process. Normally when we go through infections or we go through stuff, we have data from the past, we have stuff to base things on, we get new science and we publish it. And we look at that and say, wow, wasn't that interesting? Well, now everything's real time. And so if they noticed in China or in New York or in San Francisco that something's happening, it gets to the internet, we get a pre-production, and it looks and says, hey, we looked at these 80 patients and we're seeing this. So when the thrombosis was starting to happen, they were seeing that in the hotspot centers where that was going on, anticoagulation started. So we've been anticoagulating our patients that are sick enough to be in the ICU, that are very, very ill, for many, many weeks already. So we really haven't had a lot of thrombotic disease. We've not, well, the difficulty that we're having too is that people aren't coming to the hospital. And that's a really important part that I want to talk about, is that as COVID hit, people have avoided going to the hospital. So regretfully, what's been happening is people are at home with chest pain, people are at home with a new neurological symptom, people are at home quite ill, and they're dying at home. And so we know people have died at home with heart attacks, and strokes, and sepsis, ruptured bowel. This has all been happening at home. So people have not been coming to the hospital. So it is difficult to know some of the things that are happening, what is attributed to the COVID and other things, because if they have COVID at home and they get acutely ill, we don't know what's causing. So as far as our rate and what we've seen in our community, the amount of thromboembolism with COVID has been very low.
Another good question. When or will there be a vaccine available soon? What will the vaccine do for me?
All right, so soon is a relative term. So I don't know, there was one of the talk show hosts that talked about that, and if I say I'm going to take a shower soon and it's in 10 years, she doesn't want to be by me. But if I'm going to take a shower soon, it's tomorrow morning, that's usually an okay thing. In terms of vaccines, a soon vaccine is usually 4 years, because that's been our current cycle that we've gone through for the last few vaccines. It's been about a 4-year cycle. There's no way this is going to be that far out. We have pushed the technology extremely far. So there are 8 candidate vaccines right now. There are a number of people that have been vaccinated. We're getting some early data that the vaccine looks like it's going to be helpful. It's going to produce something called neutralizing antibody. So neutralizing antibodies are those antibodies that actually cure an infection. So if we vaccinate people and it doesn't cure you, what's the point? But it also has to prevent infection. So that's really what we're working on. So as of right now, there's candidate vaccines. There is one that's being worked on between the United States and the United Kingdom. And our overall goal, if it goes well and we can prove that it is safe and effective, it will likely be available for a small number of people by the end of this year, but no earlier than that. And if we think about that, that's a new vaccine in about 10 months, which is 3 years and 2 months earlier than other vaccine we've ever made.
I have seen talk on injecting something that tricks the body into thinking it's COVID, therefore producing the antibodies needed to fight the actual disease. If used, could this method cause the same overactive immune response since the body fights it like it would a real virus.
So that's when we talk about vaccines and their safety and effectiveness. So when I get an infection, the virus comes in my body, and viruses are amazing because they come into our body and they take over cells, and your cells are the factory that make more virus, and that virus then invades more cells. So we talk about going viral on the internet. That's what viruses do inside our body. One cell goes to 2 cells, that goes to 8 cells, that goes to 1,000 cells. So it's an uncontrolled response. When we vaccinate, we give a very small amount of a fixed dose of the material. And this particular listener was talking about the current vaccine that's being tried because it uses called messenger RNA. It's a piece of the virus that then tells our body to make a protein that the body works against. So it's a really controlled amount, and so the immune response would be a controlled response that shouldn't cause any of those issues.
So you're saying it should not result in any of the complications that we're seeing.
Correct.
Which is very typical. Vaccines don't generally cause the same complications that the natural disease causes.
Which is why we vaccinate.
Right.
Yeah.
So back again, a question about masks, and it also gets into, you know, calling people out or maybe reporting them if they're not using them properly. Someone is asking, I went into a store, someone was cutting lunch meat and had their mask below their chin. So what would this person need to do?
Well, I guess if you are seeing what you think is an inappropriate use of PPE, masking, I would talk to their supervisor or their workplace manager and try and have them enforce a more consistent utilization of masking. Please understand, though, that masks are not a perfect form of PPE. And human beings, being what they are, we're not perfect. It's hard to work behind a mask. So I would try and be polite. I would forward your concerns to a manager. And if you have concerns about your meat, don't purchase them there. Go somewhere else.
Or get it packaged.
Or get it packaged in a way. Exactly.
Handled in a different way.
Same lines about grocery stores. Do you think it's necessary to disinfect your groceries?
I'm going to give that one to you, Dr.
Right.
Brooks, because yes, go ahead.
When you go to the store, you want the cart to be disinfected because you're touching a cart that other people have touched. Now, as far as all the other items, that's a very interesting question, and my thought would be the answer is no. When you go into the grocery store, you've cleaned your hands, you're going to buy your stuff, you're going to take it home, you're going to take it out, put it on a counter, clean your hands, and most people are just throwing out the bags, which is not good for our environment. Hopefully you have some paper bags so you can actually recycle those. But that's what most people are doing at this stage of the game. The items themselves, again, if you've cleaned your hands and taken them out of the bag, I'm not concerned at all, because that's what I do. I have no concerns.
So I believe there was some recent information that came out that actually the ability to transmit the virus from on paper or some object is theoretical, but that is not really the major way we know that the virus is transmitted.
Yeah, it's the person to person is really what we've seen with the viral transmission. And the difficulty with COVID, which is why it's different than influenza. So if I have influenza A, the common force of influenza we get every year, or influenza B, I'm infectious, but I'm going to give it to 1.2 people, right? So it's 1 to 1 to 1.2. COVID, it depends on the situation. I'm going to give it to 4 or 5 people. So the factor of the ability to be infectious is much greater. So it's the person to person. It's the cough, it's the talking. So one of the things that they looked at in the viral particles, so when you cough or sneeze, we know the stuff goes out far. But if you say the ah, it's almost like a cough. So when we're talking to people, if you don't have a mask on to contain your cough and contain your secretions, when you're talking to people, you're infecting them if you have it and you're asymptomatic. So that is the issue. So that's why it's so important that we cover ourselves when we're in public. So if we have the virus, we don't know we have it, we're not infecting other people while we're talking.
Interesting, there was a CDC report that showed an individual who was infectious at they were at a concert or they were at, what do they call that when they're in a choir? And they were at a choir practice.
Oh, yeah.
And there was one infected person, almost 38 or 40 people got infected from that one choir practice because of that act of singing and being close together. So those are the kinds of things you need to think about.
Yeah.
thinking about symptoms or being asymptomatic, how are you working to convince more people not experiencing any symptoms to get tested?
Well, testing asymptomatic people is problematic because as we just talked about, we're not really sure sometimes what it means. Positive is positive, but if it's negative, what does that really mean? It could mean that you got a virus infection yesterday and you don't yet have enough of it in your system to detect it. The question again is, what do I tell people? I'm sorry, help me again. What was the question again?
How are we working to convince more people who don't have symptoms to get testing?
Well, the first thing is we have to have the testing available, free, convenient, and probably not have a nasopharyngeal swab stuck into the back of your brain so it goes. It's not that bad.
Not that deep.
But you know, it is a process that has to be done that is mildly unpleasant. So I think the first step is to make the testing easier and more accessible, and then more quickly available, the results.
Yeah.
I think once we have that, then it's going to be a lot more meaningful to do tests for asymptomatic people. And
Yeah.
John, what would be your thoughts about that?
So, and the difficulty too is that the technology platform, which is called PCR, that we do for most of these testing, none of it's perfect. You know, some of them have about an 18% false negative rate. So that means that I have the infection, but the test isn't picked up, about 18%. So that's almost 1 in 5. However, some of the platforms, 1 in 2. So we're missing 50% of them. So we definitely just need better testing. So on that thought, right now we need to understand is that the way we're doing the testing is that we're doing emergency use testing only. So these tests have not been developed and set through the normal clinical process to do a test. So their clinical parameters and their testing is not like other testing. So we know that's imperfective testing.
We have time for one more question,
One
maybe?
more question.
Okay.
I can't believe the 30 minutes has gone so fast.
Time flies.
This is a good one regarding facilities, large facilities. So we're talking probably 300 or more people a day. What do you recommend for screening? Currently doing temperatures and questions. If the temperature over 100.2, they are not able to enter, or given options and assistance if needed for linking to healthcare services.
So we're talking about what can we do to screen people, so large facilities.
Right.
And why don't you go ahead and answer that one?
So different places do it in different ways. So a temperature check is certainly something that's being done pretty commonly. And then signs and symptoms. Do you have a cough? Do you feel like you have a fever? Do you feel unwell? And then we always ask, have you been exposed to somebody with COVID? Trying to do the epidemiological link, especially when they come into the hospital.
Yeah, and as we just talked about, asymptomatic cases exist. So screenings are not perfect, and we know that. I just want to say one more time that our goal as a public health institute, as our healthcare providers, is not to eliminate this virus. We know that this virus is going to be tenacious. It's going to be with us for some time. Our goal is to prevent large amounts of people getting sick all at one time. You know, we don't want outbreaks in our long-term care facilities. We don't want our hospitals to get overrun. And so even though these systems are not perfect, they are a way of identifying cases and clamping down on them before there's the ability for them to spread widespread. So that's certainly our goal, and that's why these imperfect approaches are the best we have, and we're going to use them. Go ahead.
Any other closing?
So my only
comments?
closing would be is that if somebody is ill, if you're having chest pain, if you're having a new neurological symptom like weakness in your arm, or you're sick, the ERs are open, willing, ready to take care of you. We are not chock full of COVID. We have lots of space. Do not put off your health. Please come to the hospital ER if you're sick.
Good point. And on that note, we'll say thank you. Join us again next week, next Thursday at 3:30 for updates. And I already mentioned the weekend. So please know that our weekend data reporting is going to stop as of this weekend, actually, because of the holidays, and we will be reporting daily updates Monday through Friday, and actually this week, Tuesday through Friday, because Monday's a holiday. And I hope you all have a very safe and happy holiday. Thank you. Thanks. What?